Polycystic ovary syndrome, more commonly referred to as PCOS, is a disorder that affects approximately 1 in 9 women ages 18 to 14. And studies show that half the women affected do not get diagnosed until the symptoms have ran rampant in their body. As a young woman, it is important to keep your sexual health up to the highest level that you possibly can because it affects many aspects of your health and emotional well-being. After being diagnosed with PCOS 5 years ago, I have fought an uphill battle to get my health under control and come to terms with the many aspects of this disorder. Before being diagnosed, I gained over 100 pounds, lived with awful monthly pain, and visited several doctors while trying to find out what was obviously off with my body. There are many telltale signs of PCOS that can help you attune to what is going on with your body, but it can only be truly diagnosed with a visit to the doctor and having several tests ran. Once diagnosed, there are things that you can do to help minimize the effects on your body. First, what is PCOS and how can you find out for sure that you have it? According to womenshealth.gov, polycystic ovarian syndrome is a health problem that can affect a woman's menstrual cycle ability to have children, hormones, blood vessels, and appearance. A healthy woman's menstrual cycle varies greatly from a woman with PCOS menstrual cycle functions. In a healthy woman's cycle, the follicles in the ovary release the egg or eggs that are produced during the ovulation cycle, such as right here. And in a woman with PCOS, the follicles never release the eggs and they remain embedded in the ovary, which causes a cyst and results in a true ovulation never happening. It stops right here. Now, what exactly does having PCOS mean to your body and your mental health? There are many secondary issues that this hormonal imbalance causes within your body if you have PCOS. Physically, PCOS can wreak havoc on your entire body, ranging from the way you physically look to how your body actually functions. According to Dr. Futterwhite in A Patient's Guide to PCOS, Understanding and Reversing Polycystic Ovary Syndrome, PCOS causes irregular periods, infertility, skin and hair problems. On a deeper level, many women with PCOS never learn that PCOS puts her at an increased risk for cardiovascular disease and diabetes. Women with PCOS also have a high level of emotional issues that stem from the aspects of the disorder. Depression is often seen on the onset of being diagnosed once the full realization hits that infertility is now going to be a core problem of your life after being diagnosed. Anxiety also plays a significant role as the unusual hair growth on her face, male pattern baldness, acne, and the extra weight that is hard to get rid of begins to be how they see themselves. How can you help keep yourself healthy and minimize the effects of PCOS? When diagnosed with PCOS, you will have several options of reversing the disorder and attempting to have it affect your life as little as possible. The first option is medically assisted from the doctor. Metformin may be prescribed to help with underlying insulin issues, and progesterone could be prescribed to help your cycle go through the proper functions. Another option is to look to your nutritional lifestyle to hopefully reduce the impact drastically and naturally. Many professionals, such as Elisa Vitti, author of Woman Code, believe that nutritional changes can stabilize your blood sugar and diminish your chances of PCOS to continue to wreak havoc on your systems. The majority of literature on the nutritional needs of PCOS sufferers leans towards a low GI diet that keeps insulin spikes from occurring. In addition to nutritional changes, all experts agree that to quit smoking and to incorporate exercise will greatly help. Though PCOS is a serious disorder, there are several ways to halt the symptoms that are associated with it. It only takes some dedication to the process and an overhaul of lifestyle. If you are experiencing any symptoms such as menstrual cycles that seem worse than everyone around you, unusual hair growth or loss, and unexplained weight gain, regardless of exercise and eating habits, please visit a doctor and at least rule out the possibility of PCOS. Please remember that everyone is battling their own issues and to be kind to those who have a disorder such as PCOS, and that everything affects everyone in a different way.
It happens.